A new study out of the UK found people who suffered from mild cases of COVID-19 still had immune cells in their bone marrow months after the infection. It included 19 patients and did not look at people who suffered moderate or severe symptoms. But the co-author of the study said that these cells will live and continue to produce antibodies for the rest of the person's life. Immunotherapy scientist Dr. Nissola is with us now to talk a little bit more about these findings and other things related to COVID. So, Doctor, it seems like that's not a lot of people, 19 people, but are these findings significant? Are they a game changer when it comes to what we thought about COVID and long-term immunity?
Absolutely. That's our adaptive immunity at work. What we're seeing here is that the B cells are creating memory response to the coronavirus. And before, we didn't know how long that memory will last. Now, what we are seeing from this recent research is that it will likely last over 12 months for those who have an original infection with the virus. Now, when you add the layer of the initial infection with the immunization for COVID, what we are seeing so far, the evidence shows that we have a much more robust immune response.
So we have been hearing about, possible booster shots, though. Do immune cells differ between those formed from vaccinations versus those formed in the aftermath of an infection?
Yeah, so what we are seeing right now from the research with COVID is that immunized people are capable of producing long-lasting immunity against the virus. However, folks that have had an original infection with the virus, when receiving the second dose of the vaccine, provoke a more robust immune response in a way that makes us think at this time that people that have had infection with COVID-19 have received at least one shot of the vaccine will likely not need booster shots in the future. Now, those of us who have not had COVID-19 and only had the vaccines currently available in the United States will likely need in the future a booster shot.
Okay. I want to ask you about another study. Research published in JAMA earlier this month found that organ transplant recipients may not get protection from a COVID vaccine even after 2 doses. The CDC director acknowledged this yesterday, saying that people with compromised immune systems should still wear masks even when fully vaccinated. Explain why they are not protected, and are masks really the best option when it comes to preventing COVID-19?
Yeah, that's one of the complications of easing restrictions, is because we all have different immune responses, and we have a very large population of individuals in the United States who are struggling with their immunity, whether they are fighting off a more serious disease like cancer, or they have compromised immunity due to an autoimmune disease or any other condition. What we are seeing is that individuals that have a baseline immunity problem also have a problem in developing new antibody against COVID-19 and developing those B memory cells, those T cells and B cells that act on the adaptive immunity that occurs after either the infection or the vaccination. Now, the low antibody levels are not completely surprising to those who actually have seen patients that were transplanted or patients who suffer with immune disease or immune conditions.
I think there's a message in there. Sorry, go ahead.
In that sense, to protect those individuals who are not developing immunity robust enough to protect themselves, we should be more conscientious about wearing a mask when we go to interact with people that we know have an immune condition, but also making sure that we are all immunized to protect those who can't get the benefits from the vaccination.
Yep, doctor, that is exactly what I was going to say, that, this should sort of remind us all that even if you're healthy and you're well vaccinated, there's a reason why you're still being asked to wear masks in public spaces where there are a lot of people gathering. You really don't know what the condition is, the situation is for other people. I know a number of cancer survivors who are particularly concerned because of that, because they're vulnerable. And so they keep wearing their masks, and they would like you to as well. In general, the general you.
Exactly.
There could be another COVID vaccine available by the end of the year. There are 2 European drug companies that say phase 3 trials are underway for their versions of the COVID shots. Do we know anything about those vaccines and how they might be different than what we are already using?
Well, it's good news all around. In case these studies actually prove to be successful, and in case the companies decide to apply for a license for the drugs here in the United States, but also more importantly to the rest of the world. I think we're vaccinating people here and have been at a very rapid pace. Now, I would hope that these companies that are producing vaccines right now and manufacturing them actually start communicating with folks from countries that are struggling to find vials for the vulnerable populations that they have there.
All right, Dr. Leo Nissola, thank you so much.
Thanks for having me.